Hi, my name is Dr. Amee Daxini. I'm a practicing dermatologist in my clinic called Think Skin Clinic in Bangalore on Sarjapur Road. I have about 20 years of experience in skin care, treating patients all across the country and training doctors. I am a gold medalist from Grant Medical College JJ Group of Hospitals, and I'm here to serve each and every one of you. Vampirefacial sounds like so exotic, and I'm sure everybody wants to do it. But let me assure you, it is vampire, so related with blood and your own blood cells used for rejuvenation. Let me discuss very honestly, the pros and cons of this. I myself am not a very big follower of the Vampirefacial, but let me explain to you how it works. We withdraw a particular amount of blood from your body. That blood is then put in a sterile test tube and put in a machine where there are multiple very fast rotations called centrifugation. The blood, since it's a suspension, then gets divided into various layers. If you see, the topmost is a clear layer, that's the plasma. Then you have your platelets, then you have your WBCs, and then your red blood cells. The ideal way of a Vampirefacial is when we extract the second layer that contains the platelets. Now, platelets are known to contain certain alpha granules. Now, these granules are known to produce certain growth factors. Now, these growth factors, when injected back into your skin, help skin growth, rejuvenation, production of more collagen, elastin, and this subsequently leads to a radiant and fresh, youthful looking skin. But here you need to remember, this is in ideal conditions. But right from the first step where you withdraw the blood and then you centrifuge it, you may not get the right amount of platelet layer that you want. Now, this platelet layer then needs to be injected back into your skin, and that process is painful. Also, you may not have sufficient enough to cover the entire face. Secondly, there are also chances of infection and subsequently inflammation. So be very careful and sure whether you want to do this facial. Parallelly, you can always do other in-clinic procedures which create the same kind of benefit, like stem cell injections or your lasers, or even certain deeper peels which promote collagen and elastin, giving you an even skin tone, texture, as well as a youthful look. So a Vampirefacial can sound very exotic and interesting, but be very careful before you decide to do that. Discuss with your dermatologist and then plan it and hope for the best.